Here we introduce an innovative suture anchor onlay technique. Peroneus longus autograft augmentation for arthroscopic irreparable massive rotator cuff tears reconstruction. All the authors have no conflicts of interests. The preliminary diagnosis suggests a massive rotator cuff tear the patient with right shoulder suffered is placed in the lateral surgical position. A tear in the upper one-third of the subscapularis tendon is identified through the posterior observation portal, and the tear is then repaired with single anchor technique through the anterior operation portal. Through lateral posterior observation portal and the lateral operation portal, an irreparable massive rotator cuff tear with a missing long head of biceps tendon is identified. The required length of the tendon graft is estimated. The Peroneus longus tendon on the same side is harvested and prepared into 2 7 cm length tendon grafts to serve as autografts for the augmentation procedures. Through the lateral posterior observation portal, a lateral anchor portal is constructed along the lateral edge of the acromion. A suture anchor is placed at the posterior aspect of the footprint area near the cartilage edge. Then through the posterior operation portal, a suture hook loaded with PDS sutures is used to suture the residual tendon tissue at the posterior edge of the infraspinatus, which can partially repair the infraspinatus. Through posterior operation portal, a suture hook loaded with traction PDS suture is used to suture the residual tendon tissue at the mid-portion of the supraspinatus and the anterior edge of the infraspinatus. 2 PDS traction sutures are placed. The anterior PDS traction suture of supraspinatus is pulled out through the anterior portal and the other is pulled out through the lateral portal. Through the lateral anchor portal, a double sutures loaded anchor is placed at the mid-portion of the rotator cuff footprint area, near the cartilage edge. Then, 2 suture tails of the anchor are respectively pulled out through the posterior and anterior portals, and the first autograft is passed into the subacromial space and placed through the infraspinatus from the lateral portal. The second autograft is passed into the subacromial space and placed through the supraspinatus from the anterior portal. A double sutures loaded anchor is placed at the anterior part of the rotator cuff footprint area near the cartilage edge through the lateral anchor portal. The suture grasper is used to place anchor sutures on both sides of the corresponding grafts. Through the lateral distal portal, a lateral row anchor is used to fix the 8 sutures from the 2 autografts, placing at the lateral side of the humeral greater tuberosity footprint area. Then, through the lateral portal, the sutures from the medial row anchors are knotted to fix the mid-substance of the autografts. Next, we knot the sutures from the most posterior anchor, which is used to partially repair the infraspinatus, and another lateral row anchor is used to fix the 4 sutures of the medial anchor at the posterolateral side of the humeral greater tuberosity footprint area. Finally, the sutures from the posterior autograft and those used to partially repair the infraspinatus are knotted again. Last, arthroscopic examination is performed that the surface of the humeral head is well covered by tendon tissue. The MRI and CT showed that the reconstructed grafts and the residual rotator cuff maintained good tension, and the humeral head is restored to its normal anatomical position.